Hello, everyone. Welcome back to the Dental Hygiene Basics podcast. My name is Dana. I'm your host. Very excited to have a student dental hygienist. Yeah, student dental hygienist. I was like,
Yep.
that sounds weird when I said it, but yes, Julianna here with us to talk all things dental hygiene school. So welcome, Julianna. We're so excited to have you.
Thank you so much. I feel so honored to be asked to come and speak with you and share my story. I think, like I was telling you before, it's definitely different. It's not like kind of the norm. So it's nice, I think, to hear that people have different paths, to get to where we are today. So,
Yeah, absolutely. I love it. Well, I'm just going to let you dive in. Tell me your crazy path because I got to know.
yes. Well, let me back up just a little bit. So I uh, became a dental assistant at like 18 years old. I was a young mom and I actually went to school at night and got my dental assisting like certification. And then quickly, right after like my externship, went into oral surgery. So I love surgery. I love the combination of like the medical and dental side of things. And I worked for a phenomenal team for about 15 years. And then, bought a home, had two boys. And then out of all things, 16 years later, my husband and I got pregnant again. And so a huge age gap. Oral surgery, there's a lot going on with that. It's very all consuming and I loved it, but I also having a second chance to have like, kind of do things over, I guess you could say, wanted to take a little bit of a step back. So I ended up going into perio and I worked for a periodontist and for about 6 years. And that was actually my first time really being introduced into dental hygiene, which is so funny. Other than me getting like my normal 6-month cleanings, I was in my realm, right? I didn't do general dentistry. So that was like my first like really hard experience with having dental hygienists around all the time. And being in a perio office, like our hygienist used perioscopy, like the periscope
Mhm. Yes.
and SRPs, and we were doing surgery and LANAP, and there's a lot of crossover with oral surgery and perio. And so it was a little bit of a learning curve with some things, but then some things were like the same.
Mm.
Right. And I loved it. And I was like, okay, this is so cool. Well, being in surgery, I've been in dentistry for 22 years.
Wow.
And I had my like anesthesia certification. I've got my IV certification. I've got my phlebotomy certification. So I'm really into learning and growing. And I've always been that way. Like I'm not one to sit still. But at the same time, I had kind of gotten to a point where it's like there really wasn't anywhere for me to go. And my surgeon actually said, "Well, what do you think about going back to school? Like, what do you think about, doing hygiene and being able to do these things?" And it really like my little hamster wheel was going. So I was like, "Yes, let's do it." So that's kind of like what kind of started it. It really wasn't like on my radar. I wasn't like unhappy with where I was. But at the same time, like I was ready for more. And I was also, I think, felt like I was sitting a little bit on the sidelines. Like I wanted to be involved more. The one cool thing with perio, different than oral surgery, is that you've got a patient that comes in, their mouth is, their body is very, like they feel very defeated, like there's a lot of issues. And our practice did like the 6-month kind of protocol where they would meet with the hygienist, they would do the laparoscopy, then they would come over with us and do the laser. And then, we saw them for like 6 months. And, at 6 months and you can reprobe, you can check all the pockets and see like where they're doing and being able to walk a patient from pretty hopeless to like them really taking ownership over what's going on and they feel so good about themselves and they would come in and be like, "Jules, like look how good I'm doing." And like having that experience is really like changed a lot of things for me. I was like, this is so cool. And mind you, I was a big part of that on one side of it, but I was like not really hands on the other side of it. And so that's where I was like, this is what I want to do. Like this is the part, like the teaching part, walking them through, like meeting a patient where they're at, and like having that, influence in that part of it is an area I wanted to grow in. So I started doing prerequisites, was working. My surgeon was great. Like, was able to work a little bit less. Like they work with my schedule. And then, applying for a dental school or dental hygiene school. And for me, out of all things, the school that I really originally started with, which was Concord, opened up a hygiene program in Portland. And I was like, and mind you, it's an accelerated program.
Right.
So here I am thinking, oh, I've got 22 years of experience. Like, I got this, yada, yada, yada. Oh, honey, like, little did I know how tough it was going to be. But I did get accepted right away. My GPA was like 3.75, so it wasn't the best. But I think because I had so much experience and certifications and backgrounds, like I was a really good candidate. And so I got in on the first try.
Yeah, that's
Yeah. So
amazing.
that's kind of like a little background story, history of getting into it. We have 20 days to go and we'll be last day of school is coming up here very quickly.
Yeah, that's so exciting. I know I've been following your journey a little bit on socials, and it's
Yeah.
so fun to hear your background because, well, first of all, you don't look like you have however many, what, 20 plus years of experience. So I
I
was like,
know. Yeah.
oh, she's like 20 years old. And then you're like,
Oh gosh.
no, no, yeah. So that's just
Yeah.
so cool to hear your story and learn more about you and shared experience. I started out as an oral surgery.
Oh, I
Yes,
didn't know
yes.
that.
That was my first assisting job. I felt the same. I loved it so much too. And I really like that you transitioned into perio and then you saw the connection between this is separate but different. And then
Mhm.
you recognize that I felt the same way. Like I was on the sidelines a little bit. I
Yeah.
knew that I wanted to get hands-on more than I was
Yes.
doing already. And I was excited to kind of pursue and go further as well. So I love that you had that aha moment and that the people that you worked with are so supportive of you. That's really incredible. And something I think is so interesting. It's just been something that's been on my mind a lot lately is really thinking through like life and progression. I think back even when I decided I wanted to become a hygienist, I was only 25 when I started hygiene school, which I'm like, man, I knew what I wanted to do, right? But I could not have envisioned all of the things I've done since, right? And look at you, you've had this long, amazing career. You've gone oral surgery, perio, and now you're even continuing on. And I just think our life has to unfold in a way we can't always see the bigger picture, right? And
Yes.
and I love what you said, like I'm still learning, I'm still growing. It never has to be stagnant. And
Yeah.
I know you're going to keep going and do so many amazing things in your career. So I'm so excited for you. Are you thinking when you graduate, are you going to go work in perio? Is that kind of your thought process?
I think so. Well, we'll see. We'll see how
Yeah.
it goes. I will definitely say I certainly lean towards local anesthesia and SRP. And I really definitely enjoy that a lot more for sure. So I would love to pick up, a perio day, or definitely have that more included in my choices. I think that's one of the cool things about dental hygiene that I've learned is like I want to have options, So I like having like consistency, like I need a schedule, but I also want options in that schedule. So I've been thinking about this like a lot lately since we're coming to the end, right?
Yeah.
And I would love to do, have some consistent days maybe over at this practice and then maybe have like a consistent perio day, work at this practice and, kind of get a feel for different things and what that looks like especially at first, right? I don't know if I necessarily want to temp. I mean, I might. I don't know if I necessarily want to temp like consistently. But even if I'd be okay if I was like at 2 different practices a week, just having some variety, also having different people, and I think it'll just be nice for the first time ever having, those kinds of options. I know here in Oregon, we have to work for 2 years, we have so many hours before we can apply for that expanded, kind of like expanded functions, like adding to our license. Eventually, to be honest, like I would love to have my own I don't know necessarily like brick and mortar, kind of place, but, definitely definitely maybe even like renting out maybe like some space to have hygiene on my own to be able to slow things down a little bit, be able to spend a little bit more time, or maybe even like a mobile service where I can meet people where they're at, like in our community. Like there's so many people that need help. Again, just kind of having that like options, and before school, like I didn't have any options, right? And I think that's like one of the things I'm most excited about is just being able to service people in our community. I live in a smaller town, like about 45 minutes north of Portland. It's a smaller community. And a lot of people don't want to have to drive, or they're not able to drive. Or, there's several, older folks' homes,
Yeah.
where you can kind of go in and help people out. And, there's just options there to be able to help people. And so I think being able to do that is like definitely where my heart is. I was introduced into public health for the first time because I've always worked in private practice. And honestly, it's going to sound terrible, but at first I was like, "Ooh, I don't know about this. Like, what is this all about?" I was a little judgy at first, like, but then it has such a mission feel to it. And I was like, I love this. I
Mhm.
love this. And I have an instructor who's amazing, who has worked a lot in public health. And her and I have had some extensive conversations about it. And I would love to spend some time especially right after school. So she's helping me kind of work through that process of getting in, 'cause it's a little different than just private practice, especially like when it's kind of government, you know?
Yes.
But,
Yeah.
a Native American community, there, that I can also participate in, and so which again, kinda going back to, like, perio and SRP, there's a lot of opportunity for that there, and I love that, and being able to spend a little bit more time and not have to be so constricted on time or services, so I think that's kind of where I'm leaning.
Yeah, I think that all sounds fantastic. What I hear is something that I do is like I have a career bucket list. You're like, I want to try all of these different things. And as you try, two things happen. One, you figure out what you don't like. And two, you
Mhm.
figure out what you do like. And as long as you're pivoting towards that alignment and what's making you happier, every single day. And that could be small things in your life. You're like, I know if I buy this instrument, it's going to make me happier. I know if I go try this and I like it, or maybe I hate it, at least I know. And the more that you experience and try, I think the closer you get to that true purpose and fulfilling your passion, I know that you're going to get there, which is very exciting. So, very, really exciting stuff, hearing makes me think just all of the things I remember wanting to do when I graduated. And I remember I was like, I'm interested in public health, I'm interested in working with older people, and I've done all of those things. And there were some things that I loved and some things I didn't love, but now I know more about myself. And for me now, it's like I know education is my passion, right?
Yes,
But I can't
yes.
wait to see what unfolds for you. It's just going to be so great. It really is.
Yeah,
Yeah.
and I love the education piece of it as well.
Mhm.
I'm gonna graduate with an associate's. I won't have my bachelor's, so but I do know that that's an option, to do that. And it's probably more from like my, from social media. Like I do love explaining. I do love helping. Like
Yeah.
when I got into this, I had no idea, and this is gonna age me a little bit too, being 42. I really wasn't into TikTok until hygiene. And then I forget, I got on there for something and I was like, "Oh my gosh, this is like all things dental hygiene." I couldn't believe it. I was like, "Okay, this is where it's at." But at the same time, I was like, "There's really nobody telling you like what is it like really what does it look like?" You know?
Mhm.
I was like, "What's Yes, I love the cute outfits. I love the bags. I love all those things. But like what is the like I'm such a real like let's do real lists. I'm so down to earth that way. Like show me the nitty-gritty. And
Yeah.
so I think that's kind of where it just started. Like, I was like, okay, if I'm asking these questions and all my classmates are wondering, like, we're not the only ones, right? And I'm such a huge person for asking questions. Like, I'm a
Yeah.
huge advocate. Like, if you ask anybody in my class, it's like, I will be always raising my hand for wanting to understand something. I don't hold back that way. So, that's kind of where that all started was like, hey, like, this is what this looks like, this is how this works, or all those kinds of things, and just trying to help people. And I can easily see myself also being in education and helping students that way. That also makes me feel really good. Of course, that's going to come with time because you have to have a certain amount of time underneath your belt, so
Yeah, well, I always think too, I see the big picture because I've worked in so many different opportunities. And, it's like
yeah.
right now, I work in public health one day a week.
Mm,
And the day that I work, we have dental students that cycle in. So I get to help educate the students while working in public health, serving a need, right? So I could see you working in the Indian health services, and a
yeah.
rotation of dental hygiene students comes in, you're teaching, you're working on perio, it's like whatever you think and envision, it can come alive. You just have to, like I said, keep pivoting to finding that alignment, and then next thing you know, you look up and you're like, wow, look at what I'm doing, this is super cool. I mean, it's just like anything in life. So well, I want to know, because you are sharing your dental hygiene school experience, and everyone's grateful for that, because we need to hear the nitty gritty. So what do you think has been the hardest part of dental hygiene school?
Oh, yeah, I thought about that question. I think 2 things. One, like finding patience. Like
Yeah.
it's not so much necessarily like well, no, I guess it is. So finding patience is probably one of the hardest things. And what comes along with finding patience is the communication piece, right? So it's so time consuming. You'll be working on an assignment, you'll be studying, be, you've got this paper due, you've got this discussion board due, and then all of a sudden, someone's messaging you like, "Hey, is this available?" I have found a lot of my patients on Facebook Marketplace. Kid you not. And then you're going through that process. Yes, it's available. And that communication piece, it's so time consuming. Then you got to email. Then you got to find out if they got the email. Then it's like, okay, did you get me their paperwork? Okay, great. Now we got to confirm this. Then we got to get, it just for me, it's like, it just took away so much time from things that I really felt like I should be focusing on. I really wish that was changed in school. Yeah,
Yeah.
like that's probably one of the biggest challenges. And right now we've got like the next class coming up, behind us. And the other day they were grilling me, like, okay, they were asking all these questions. And I was like, well, this is what's worked for me. And this is, all the things. Because it's a huge, huge hurdle. And because I have experience, because I've kind of done all the positions you can imagine in dentistry, I've taken like a lot of those front office skills and just applied them to this. And I think I can count on one hand the amount of times I haven't had a patient in my chair. Like I've been pretty fortunate that way, but I'm also very diligent in like, communicating with people. I would say that's probably one of the biggest challenges. The second biggest challenge is, again, I can only experience or, say from being in an accelerator program that it is no joke. Like, there just isn't any time to really let these concepts set in before you're just like on to the next thing. I would say like the last 2 years, there's like no life. You have no life outside of, you have to almost be obsessed with your studies because you're on to the next thing. Billy Lunt from the Happy Flosser, she
She's like
just
my best
named.
friend. I drop her name in
Is
like
she
every
really?
yeah,
Okay,
I
good.
drop her name all the time. I recorded 2 or 3 podcasts recently and I was like, "Billy, if you're not following Billy, go follow Billy at the Happy
Yes.
Flosser." Yes,
Well
yeah.
well, I will, like the two of you have had like the most influence, I would definitely say, on me, but as far as that goes, but she just put out an episode about dental hygiene burnout
Yeah.
and how that starts in school and like the stress of it. And literally the day before that came out, so at our clinic, we've got 30 students. We have 15 dental chairs in our clinic. And so our class is broken up into two groups. So you're broken up into like pods. So we're the A pod. And our girls, like we were discussing, it's like the stress, it's you might have like a stressful event in your life, like something happened and it's crazy. Like, something happens in your life and it's maybe will last a couple days or a week, or maybe it's 2 weeks, something like that. But to have this intensity and this stress for almost 2 years, it is like next level. And I had been holding it together. I'm pretty good in a lot of things, but this last term, like I would say this last month, it has really kind of for me gotten to me. And I
Yeah.
I was like I told my husband, I was like, I know finances are tight because we're living off of one income. And I said, but this family needs a break. We
Yeah.
need a break. Things are just tense. You could just feel it in the air at school. You can feel it in the air here. And she was like, you got to take, like, what did she say? She walks the quad, I told him, I was like, we need to go to the beach. Like, let's,
Yeah.
it's an hour and a half from us. Let's, even if it's just one night, let's just get some fresh air, get a change of scenery. So I think coming into school, or if you're in school, or if you're thinking about it, maybe like have that set of like when that wall comes, and it will, what am I going to do? Like, what
Yeah.
is going to be my outlet? Who do I have a person to talk to? I think that intensity is tough. It's not what I expected.
Yeah.
And then finding the patients, how time consuming that was going to be is also another thing I wasn't expecting.
Yeah. I mean, those are such great tips. And I love what you said about coming up with a plan for the outlet before you hit that point.
Yeah.
Because hopefully, if anyone's been listening to the podcast long enough, if they've listened to the guest episodes, they know that it's coming, right? Like, it's
Yes.
very unusual for you to not have a moment where you're just like, oh my gosh, like I can't take it anymore. And I
Yeah.
think that's such good advice to have your plan because you know it's going to come at some point. So, what am I going to do for myself in that moment? And to give yourself the grace to do that, it is
Yes.
what it is. You have to just
Yes.
accept that. Yeah, I
Yeah.
love
And
it.
I'm the type of person that like really likes having it all together.
Yeah,
But
same.
there's been so many moments lately where I'm like, I don't have the bandwidth
Yeah,
to do that. Like, my husband has like he's like on clinic nights, I have PM clinic, and he's like on dinner, and he's like, well, what do you want? And I literally I'm like, I don't even know. like, just whatever you make is fine. I don't even care at this point. Like, I can't even deal with that right now because,
Yeah.
like, our HESI exit exam is coming up. Our local physical exams coming up, our clinical exams coming up, and then the NDBHE is coming up. Like,
Yeah.
it's just so much all within like weeks. I'm like, I can't. Like,
Yeah.
even the smallest decisions, I'm just like, nope.
I've been there. I get it.
Yeah, and it's, like, so not me that it's, like, I like you said, just having that grace of being like, I just can't right now."
Well, I would say too, getting to the end of our time and, thinking through the advice I would give, if I was in your shoes and hearing, I mean, you've put so much work in. You're on the path, right? You've
Yeah,
dedicated almost 2 full years to this. My recommendation to you, take a little bit of time off when you're done. I did not,
yes,
and I think that would have, I know it sounds crazy to be like, "Just take 2 or 3 weeks, maybe a month if you can swing it." I think that would have made the difference because I wrote a whole article about burnout in dental hygiene school and how it followed me into my career. I never gave myself a break. And
yeah,
so I'll encourage any other new grads, because I know this is new grad season, to take that break as well. But yeah, I love what you're doing. I love that you're sharing the hard parts and you're giving good tips for these students. I would love for students to come find you, follow your page.
yes,
Yeah. So
yes.
can you just share where they can find you?
Yeah, so it's philosophy, Flofssphy, like floss, okay?
Yes.
Yeah, so philosophy by Julianna. It's any like the little things that I love sharing the real things. Like I think I just did one on paperwork. The amount of paperwork, like what
Yes.
does that look like? Because that's another huge thing,
Yeah.
assessments, being organized, all of the tips and things that like inside and I love answering questions. I love it when people just like direct message me and I can be like, here's all the things. Like I have
Yeah.
nothing to hide or gatekeep or, anything like that. I love being able to share and help out in any way that I can.
That's amazing. I love it. All right. Well, thank you so much for being here and sharing your
Yes.
story. Best of luck on your future career, and you'll have to check in. We'll get you back on maybe after you've been working for a while and see how things are going.
I would love that. I would absolutely love that. Thank
Yeah.
you so much, Dana.
Of course. Thank you, Juliana. Take care.
You too.